music therapists can provide opportunities for staff either individually or in a group to process that and to create meaning around that loss and experience for them so that they have a safe place to express themselves. And sometimes using music as that tool helps create the space that does feel even more safe. It's not necessarily having to talk to somebody directly.
You're listening to the Oncology Nursing Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Jaime Weimer, Manager of Oncology Nursing Practice at ONS, and today we're talking with Susan Yaguda, Manager of Integrative Oncology and Survivorship at the Levine Cancer Institute in Charlotte, North Carolina, about how oncology nurses can collaborate with music therapists successfully to integrate music therapy as part of a comprehensive care approach. As a reminder, you can earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Thanks so much for joining us today, Susan.
Thanks, Jaime, for having me.
Well, wonderful. So to get started with our discussion today, can you just help define what music therapy is? And we can call that MT as a way that it's described, kind of shorthand. But can you explain what music therapy is and how it's used as a supportive therapy?
Sure. So I'll take the definition just directly from the American Music Therapy Association. And music therapy is a clinical and evidence-based use of music interventions to address and accomplish non-musical individualized goals within a therapeutic relationship. It has to be provided by a credentialed professional who has completed an approved music therapy program. And music therapy interventions can address a wide variety of healthcare and educational goals.
That's very informative. Well, so you mentioned having that special education and training. Can we elaborate on that? What is that special training required to become a music therapist who works with patients with cancer?
So music therapists have to have a minimum of a bachelor's degree from an accredited music therapy program. And then they also have to complete a 12-hour clinical training internship. And then after they accomplish all of that, then they must hold a credential called MT-BC, which is Music Therapy Board Certified. And that's issued through their certification board. Music therapists also have to have a good knowledge in psychology and medicine and, of course, music. And then they also have to have a level of expertise in both piano, guitar, and voice. And oftentimes they bring many other instruments to their work as well.
It's very interesting. And it just goes to show how specialized the work is and how much education and training really is required. So let's talk a little bit about how music therapy may be different from just simply enjoying music or listening to it and feeling relaxed. What is there evidence to support its efficacy and used in this way?
Yeah, I'm really glad that you asked that question because I think it's very important to differentiate using music even for therapeutic means or enjoyment versus music therapy. So a lot of people use music listening for enjoyment, for distraction and relaxation. And we may use music for things like being more energized. A lot of people have their workout playlist or, something that kind of pumps them up before they're going to go play a tennis match or something like that. But in using music in this way, there isn't really a specific therapeutic goal, and the relationship in these situations. And while any of us can provide recorded music or live music to patients, certainly our care partners, if we're not trained as music therapists, it should not be considered or referred to as music therapy.
That's an important distinction. And I think as nurses, we understand the importance of clearly defining what our role is, what our scope of practice is. And so I think that's a great parallel to draw of that. Music can be used in a lot of different ways, but there's a very defined way that makes it music therapy. And so I think that's an important distinction to continue to explain to patients. So let's talk about a little bit about how music therapy can be used as a tool with patients during their cancer care journey.
Sure. So we use at Levine Cancer Institute music therapy in many different ways. And I can just give you like a few examples. Oftentimes, patients newly diagnosed, it may be their first time in the chemotherapy infusion suite. Of course, there's a lot of anxiety. And our music therapists do rounding in the infusion suite on a regular basis. And we have such a great working relationship with our nursing team there as well, that they often will have already identified a patient who could possibly use some support and assistance, better managing their anxiety of this, initial experience receiving chemotherapy. The music therapist will introduce themselves to the patient at that point, will describe what the service is, will also assure patients. Oftentimes people think, oh, well, I'm not very musical. I don't think this is for me. You don't have to have any musical background in order to benefit from music therapy. So that is, something that we like to make clear on the upfront. And then they'll work with the patient to create just some tools for them to better manage their anxiety. It might be using music to help regulate breath work, to reduce stress and anxiety associated with whatever they're having done in the suite. It can also be used as a distraction. So, for example, maybe their port is being accessed for the first time, and so they can work with the music therapist. It allows the nurse to then be able to better focus on at hand for the nurse and just creates a better experience for the patient to move forward. I always love to hear when a patient can have this relationship at the beginning of their treatment with a music therapist, because then that sets the stage for just a more positive experience always moving forward. Oftentimes, after that point, our patients may be starting to experience some other troubling side effects or symptoms from their treatment or their cancer. The music therapist can help them with better manage those in a supportive way. And this can be done in things like techniques to help them manage pain, techniques to help them maybe de-stress and get more restful sleep even. Also just tools that they can take forward in their lives to use at any point anyway. And then also, sometimes our patients at the end of treatment really benefit from music therapy. So, for example, when our patients we find are in the midst of active treatment, there's always so many appointments and a lot of activity going around, trying to just kind of keep it together through that more rigorous period of time in their treatment. And so, when the dust sort of settles, they're left at a point to have to really process this whole experience, which of course can be quite traumatic for a lot of people. And so the music therapist can work with them, again, using evidence based interventions to help them create some framework around that, create some meaning around it, and be able to process that over time through the therapeutic relationship with the music therapist so that they can then step forward through survivorship in a more positive way. A final way that I always like to share with people just some of the value of music therapy is legacy work. So, when patients are well aware that, things are kind of winding down for them, and yet they really want to create something for their loved ones that will exist always moving forward. Our music therapists can co-create some music with our patients that is meaningful and have a recording then that can be gifted to their loved ones as just a very sweet reminder of this person that was so important in their lives. And we can do that also using this really cool technique called recording stethoscope, recording the person's heartbeat, and then the music therapist and the patient can co-create music around that heartbeat. And again, make a permanent recording of it that the family will always have. It is just super meaningful and really powerful work in that way.
Oh my gosh, that's so amazing. And I've never even heard of that being possible. That's just so wonderful. I think you made a great point in that, much like pharmaceutical therapeutics that we would use, antiemetics, things that you use early and sort of prophylactically. What I'm hearing you say is that integrating music therapy and meeting that music therapist as an integral part of that care team, the earlier is better, because then they can provide those tools to patients early in their care. And then they will be able to use, not that they won't maybe need additional guidance or additional sessions, but the sooner that they can learn some of those techniques and tools, the more they can apply them throughout their therapy. So it just resonates with me how important it is to make sure patients are aware that if this is a resource at your institution, if you do have music therapists available to patients, understanding how you can make sure patients are aware that they're available, create that connection early on in their treatment so that, again, they can be just another complement to the overall treatment that we're walking our patients through.
Yes, absolutely, Jamie. And they are able then to develop tools to take them well beyond their cancer experience. I also like to always make sure that listeners understand we're not saying that music therapy at all takes the place of appropriate use of medication to manage nausea or sleep or any other side effects, but it can be a very, very helpful complementary therapy.
Absolutely. So I did have the pleasure of working at an institution that did have music therapists available and as part of the staff. And I always remember when I would walk through the infusion suite and I would hear the harpist or hear the acoustic guitar down near the cafeteria, which again, that might not be back to your definition and clearly defining what is true music therapy. While I was probably not receiving therapy from that music, it was still very impactful and just very helpful for me as a clinician, as a nurse working in that environment. So can you expand a little bit about how music therapy support can help extend to clinicians or other members of the healthcare team?
Yes, our team has been able to connect with not just our nursing staff, but everybody from the lab, from clinical trials, from the pharmacy team to help provide teammate support, and has kind of gotten into a rhythm of doing this on a regular basis. Now, part of it is just being in the vicinity of the music therapist working with a patient. I think can also be therapeutic to the nurse or other clinical teammate who's involved in that situation as well. Sometimes a nurse has said to me, having the music therapist there helped me feel calmer when maybe they were having a hard time with an IV start or, something of that matter. It not only distracted the patient from what was going on, but it also had a calming influence on the nurse that was performing that procedure. The music therapists have worked with small groups of our teammates. They have done things that have helped lifted morale, helped them build together as a team. And of course, no surprise over the past 3 years now, nursing and other healthcare professionals have been so challenged with all of the impact of the COVID-19 pandemic. We have really committed to this even more at this stage in the game. And so they've done things like group songwriting sessions that have been not only meaningful in a way for teammates to recognize and show appreciation for their colleagues, but it's also been very fun and just morally uplifting. We also did a fun thing with teammates, for example, around Valentine's Day. They could fill out this form and request a secret Valentine be delivered to somebody, and it was a musicgram. So we kind of got the schedule for the day, and the music therapists were running around the whole institution delivering these musicgrams to their colleagues. And it was just really fun for people on both ends of it. The person that submitted the request for it, so fun for the person that received the musicgram. And then, of course, the music therapist just had a blast as well as everybody else in the vicinity when that was happening. And that was just, again, a really uplifting experience. They also work with our teammates, though, when there may be something going on that has been very traumatic for the staff. So, it could be a patient not doing well, maybe an unexpected death, or even, somebody that the team had gotten really, really familiar with and familiar with that patient's family who has passed. And then the music therapist can provide opportunities for staff either individually or in a group, whatever they feel would be most therapeutic, to process that and to create meaning around that loss and experience for them so that they have a safe place to express themselves. And sometimes using music as that tool helps create the space that does feel even more safe. It's not necessarily having to talk to somebody directly, but music is the vehicle for doing that processing work. And so we have found that staff has really responded very positively to those opportunities as well.
That just sounds amazing. I'm still smiling at the thought of those sort of traveling Valentine sort of musical telegrams. I'm sure the patients enjoyed seeing it too, just being there to witness it and just see the joy from the care providers that were taking care of them as well. What a fun way to integrate that. Now, one question I have is music therapy typically sort of experiencing music, or can it actually be like creating music, playing music, or being more actively involved in the creation of the music?
It can be both. And really, the music therapist will do his or her assessment and determine what's going to be most appropriate in the moment. And that doesn't mean that that would always be the type of music therapy intervention that a specific patient would receive, but it might be what they receive at that time. So, for example, there's receptive music therapy. So, that is basically where the person receiving music therapy is not co-creating music or writing lyrics or anything like that. They're just listening. There might be some paced breathing exercises that are incorporated into this. It tends to be more like a repetitive type of cadence to the music that can help create just being in a better zone if they're trying to bring the anxiety level down. And then they can also do things to like re-educate patients using music. And that can be also focused around things that trigger anxiety, or if somebody's experiencing pain, using the music to sort of transfer that pain in a different way to make it more manageable. And so that involves a little bit more involvement from the patient's side. But then there's a very active music therapy where they may be doing some songwriting, or they may be doing some lyric analysis, and they may also, again, be composing music together and just creating music together where patients are very actively involved with it. We don't do as much of that type of intervention, for example, in a infusion suite, just because there's other people around, except that the music therapists have really come up with some very great ways to use technology. So, for example, using headphones so that just the music therapist and the patient are hearing what's going on. It's not going to be bothersome to anybody else around there who might not be interested or may want to rest. And so they can do some of that there, but they also do it in individual sessions and groups and classes. So there's a gamut from being very receptive to very involved, depending again on what the need is.
I love that. And as you said, sometimes it's necessary and appropriate to be providing that at the point of care when they're actually receiving their treatment. But obviously that can also be done outside of that active treatment, still providing them with the tools they need to kind of apply them when they're getting their treatment. Or as you said, it could even be in the survivorship setting where they're kind of processing and working through just the events that they've been through. And so it sounds like it can be anywhere and everywhere and anytime, just depending on kind of how the program is structured.
Yeah, exactly.
So let's talk a little bit about how oncology nurses can be involved in a music therapy program or even a session. How do you see nurses being able to advocate for music therapy, whether they have a program or they have maybe clinicians and resources, or maybe they don't? What do you see as the nurse's role to be able to bring this type of treatment to their patients?
Nurses are the best patient advocates. They have those relationships with their patients. And so what we have done in our institution is we've tried to also avail the music therapy team to create relationships directly with nurses. And that has come somewhat from some of the staff care involvement that the therapists have been doing, but really just to form, again, collegial relationships, and so that there is a good understanding. I think when you experience something, then you're even better able to really authentically advocate for it. And so by being educated and understanding how to make a referral, for example, in an institution that does have music therapy, how can the nurses best identify patients who could benefit from that? And again, I always like to say, remember, it's not just somebody who maybe has a musical background. Oftentimes, we find that patients who maybe before they were diagnosed with cancer were professional musicians, music is too close to them to really be able for them to work with the music therapist and use it as a therapeutic tool. So not to assume that you have to have a musical background in order to benefit from music therapy. It can sometimes be the opposite. And then just increasing the awareness in institutions that do not have music therapy. I really advocate for considering it as an adjuvant therapy resource for institutions. We know that that's not always going to be available to everybody. Nurses can do things using music that's not music therapy as a tool. There was actually in the Clinical Journal of Oncology Nursing quite recently an article on the mindful awareness of music for symptom management that was very well written by Samantha Manassian and just described how they created playlists of widely varied genres, that they also created access to things like Pandora or that type of thing that patients could access. And again, it's not music therapy, but it still is using music to help support patients with any need that they might be having in the situation that you don't have the access to a music therapist.
I love that. I think those are some great ideas. Harking back to my own experiences when patients are in our infusion areas, potentially there for a whole day or multiple days if they end up being admitted for their treatment, we always want to help them find ways to stay relaxed, stay calm, pass the time. And so often, especially with all the technology, it's bring your iPad, watch a movie, having TVs available. But I think you brought up a great idea that, sometimes we just need to offer them the ability to listen to different types of music. And now with all the different apps and things, that might be an even better way for them to help just stay relaxed and stay focused and also pass the time as well. I think your comments about how can you encourage and champion the idea of bringing music therapy as a consistent offering to patients certainly is not an easy one to solve just in the environment of healthcare. But even if what I've seen done at times, or if you have patient support groups or, things that are happening kind of outside the regular care delivery, but still patients are there and receiving support, maybe you can start with finding a music therapist to come to one of those meetings or provide some regular sessions in that setting, then getting the feedback from the patients of what we assume will be positive feedback of them liking it, enjoying it, and being able to provide some of that information of, here's what we've done. We've piloted it in these ways, and this might be enough information to then, again, bring those music therapists into the fold during active treatment and during, the regular hours of care. So just some ideas there. And, I'm sure other institutions that don't have a full-time or a kind of a consistent presence of music therapists within their program, they might have connections to their community if they know that there are members of their community who are musicians or are a music therapist by actual training, just trying to highlight and make those connections so that there's an awareness of what resources you have in the community.
Yes, definitely. There's also a good body of growing evidence, that has been published in support of music therapy in a wide realm of healthcare settings, but in the oncology world as well. I just encourage nurses to kind of continually dig into that body of evidence and as they're kind of building their case to bring something like this to their institution too. So lots more work to be done, but it's a really exciting and evolving area.
Absolutely. Are there any specific clinical examples or scenarios, situations, if you will, that you see the music therapists approach differently or, be more sensitive in their approach when they're working with patients?
Yeah, I can give you like a couple of different examples that we are really fortunate to have One of our music therapists is trained in a method called the Bonney method for guided imagery and music, which is a very prescriptive way of using music and kind of helping a person into a meditative state that can help them process a lot of experiences, including trauma. So he is starting to implement that here to help patients really more post-treatment to process maybe not only just their experience with having been diagnosed with cancer, but we know our patients come with existing challenges from life in general too. There was one young man that stands out to me who was diagnosed with testicular cancer, and he had anxiety before his diagnosis. So he would, had always really been challenged with anxiety and panic attacks. And so they started working together right at the start of his treatment, which was great, and really focusing on just very simple breath work, very repetitive music cadences to help the patient just go back to that again when he felt himself, where in your body are you feeling this? And then you can identify that pretty early on and start to go back to those techniques learned in the sessions. And then they continue to work together, and he's post-treatment. He's doing very, very well from an oncology perspective, but he's still really struggling with anxiety and panic attacks. And so they're going to, again, be working together and use this guided imagery and music intervention to help him kind of sort through that. Our other music therapist comes to us also with additional training in neurologic music therapy. And so she co-treats often with our cancer rehab team. And so she uses music as a tool for just a wide variety of challenges that our patients may be having. And there was one gentleman who had a CNS cancer, and he was having some difficulties with memory and even remembering how he and his wife met and, the start of the relationship. They had been together for decades. And of course, this was so sad and hard on his wife. And so what the music therapist did with this gentleman and his wife is they co-created music around their relationship from the start to present. And because there was that added dimension, he was able to hook on to that and help him with the memory around all of that, which I can't even imagine how meaningful that experience was also for his wife. And so having those specialty trainings on top of their board certification has been really helpful for us. And then they each have kind of their other areas around music therapy that they are particularly drawn to. Our one music therapist really loves to do songwriting, so she engages patients and our staff a lot in that. And then our other music therapist, he's also a percussionist, so he loves to do our drum circles, which are so fun and just uplifting for both patients and for staff too. So again, just everybody brings their toolbox, and it's been really fun to capitalize on each of the strengths or all of the strengths really that each of the music therapists bring to our institution to best serve the needs of our patients, our care partners, and our teammates.
I love it. It sounds like a great program, and I wish every care center could have access to what the great program is that it sounds like you have and have built there at the Levine Cancer Institute. Well, Susan, thank you so much for spending time with us today. As we approach the end of our episode, I do like to ask just a few quick fire questions to help summarize what we've talked about. So to start things off, what are some common misconceptions about music therapy?
Yeah, I think, you had touched on this earlier when you asked me the differences between listening to music and music therapy. And a really common misconception is that it's entertainment. And of course, we want it to be a good experience for people, but there's a big difference between listening to music while you're walking or driving or sitting and relaxing and music therapy. So music therapy is not entertainment. That is my number one kind of pet peeve because I continually do hear this, and it just gives opportunity to kind of educate people of the value of music therapy.
Next, how can healthcare professionals evaluate their own implicit bias, maybe about music therapy, before introducing it or addressing the option with their patient?
I like to have healthcare professionals experience the power of music therapy personally, if we can arrange for that, or to be witness to the impact that music therapy can make on a clinical situation. And then having that experience helps increase their awareness and just attaches more value to what the music therapist brings. So I like to think about music therapy as just a really meaningful and important aspect of cancer care instead of something that isn't that nice to have. And so getting back down to how they can impact symptom mitigation, how there's so much clinical value at all stages of the cancer experience.
Kind of leading into this question then. So what's something about music therapy that's not often discussed, but you wish people knew more about?
Well, music therapy is very versatile. So, for example, in one music therapy session, the music therapist could be working with the client or the patient, fine motor skill, maybe managing some challenging emotions, as well as managing some pain that they may be having. And all of that can be just in the same session. So it's a really versatile, integrative modality that can be kind of modified very readily depending on the needs. And overall, music therapy is actually very cost effective. So it doesn't have to be a very expensive therapist to bring in to the setting, and they can have a lot of impact so that cancer institutions can really get a bang for their buck in that investment.
We've already talked a little bit about how you recommend sort of the experience, just experiencing it as a clinician so that you can then better explain it and advocate for patients to receive music therapy. But is there any additional training or education that oncology nurses can seek out to better understand music therapy?
I think, review the literature. ONS for the two journals has actually a significant amount of literature that discusses music therapy for sure. I always do encourage, even if you find a music therapist in your community, if you could maybe see if they would be willing to come and do an in-service for staff. And then there's also resources with the different organizations. There's the Certification Board of Music Therapists. Each state typically has its own state-run music therapy association. And then there's the American Music Therapy Association as well.
Finally, are there any additional resources that you would recommend for patients or other providers, maybe not in the oncology space, to learn more?
So for patients, if they don't have access to a music therapist, but they're interested in maybe trying to get connected, I do recommend going to that Certification Board of Music Therapists. You can find the therapist button in there and find somebody in your area, or contact your state music therapy association as well. Sometimes patients can be our biggest advocates for getting these services on board in institutions. And so, I always encourage patients to be a squeaky wheel and, let their needs be known, and how this could be something that could be really valuable to the institution as a whole.
For sure. I love it. Well, Susan, thank you again for just all the great information you shared. Really, I think helped give me a more comprehensive understanding of all the great benefits of music therapy. Do you have any final comments to share with our listeners today?
I just hope that this sparks interest in those institutions that do not have music therapy on board yet, that maybe nurses can kind of start to be advocates to consider this. And I'm happy to connect with anybody. Again, it's something that I just value so much that we're able to bring for our patients and care partners and teammates. And I would like that for everybody.
Great. Well, thank you again, Susan. It's been great talking with you.
Thank you, Jaime. I appreciate it.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.